Just as above-mentioned mesonephric duct opens into the ventral portion of the cloaca. At the 5th week, ureteric bud is formed by an outgrowth from the mesonephric duct. At the 6th week, urorectal septum develops between allantois and hindgut. At this time, ureteric bud and mesonephric duct share one common entrance into the ventral part of the cloaca. Subsequently, as the cloaca enlarges, the caudal ends of the mesonephric ducts are incorporated into the dorsal wall of the ventral portion of the cloaca. Ureteric buds come to open separately into the ventral portion of the cloaca. The parts that mesonephric ducts incorporate into the urogenital sinus approach to each other and fuse and then grow downward, forming one triangular region in the dorsal wall called trigon of the bladder. The caudal end of the mesonephric ducts contribute to the formation of the trigon of the bladder. When the urorectal septum meets and fuses with the cloacal membrane during the 6th to 7th week, the cloaca is divided into two portions. Dorsal portion is known as anal rectal canal. We've already talked about it in the development of the hindgut. The ventral portion is known as urogenital sinus. Now focus on the evolution of the urogenital sinus. Urogenital sinus is divided into three parts: craniovesical part, medopelvic part, and caudophallic part. The caudophallic part gives rise to vagina vestibule in female, and in male it gives rise to penile urethra. The medopelvic part gives rise to urethra in female, and in male it gives rise to prostatic and membranous part of the urethra. The craniovesical part expands and becomes bladder. The cranial part is continuous with the allantois, as the allantois from the bladder to the umbilicus remains as a narrow duct called urachus, extending from the apex of the bladder to the umbilicus. After birth, the allantois soon constricts as the lumen is obliterated. The urachus becomes a thick fibrous cord called median umbilical ligament. If the lumen of the urachus persists after birth, urachal fistula may allow urine to drain from the umbilicus. Now focus on this picture again. There is a thin layer of the mesenchymal cells between the ectoderm of the abdomen and the cloaca during the 4th week. Mesenchymal cells in this region participate in the formation of the muscles and connective tissue, including the muscles in the anterior wall of the abdominal wall and muscles in the bladder wall. If the mesenchymal cells fail to migrate to this region, no muscles in the anterior wall of the abdominal wall and no muscles in the bladder wall. This is atrophy of bladder. It's usually accompanied by the incomplete median closure of the inferior part of the wall. Well, this is the development of bladder and clinical correlations. Now share one case. Immediately after birth of a boy, a moist right protrusion of a tissue is noted just superior to his pubic symphysis. After observation, urine drainage is noted from the upper lateral corners of his tissue mass. Could you please make the diagnosis and explain the embryological origin of this defect? Thank you.